There is no incompatibility between clinical practice, academic excellence and business enterprise. These are things that can be put together, but you need the right team of people.
Apni Sehat is a temple-to-table community program for the prevention and management of diabetes and cardiovascular disease. As a social enterprise pathfinder, they will continue to develop a portfolio of educational material, risk testing and clinical services to deliver to Sikh communities through places of worship.
Britain's South Asian community is faced with an epidemic of diabetes, heart disease, cardiovascular, strokes and kidney disease. For this reason, I think it's terribly important that we look at how we can better prevent these diseases by working with these communities, educating them about what they can do with their lifestyles, and look at screening them, making them aware of the complications of these diseases. It was also important that there were activities that the community could get involved in. So for example, in this centre there are yoga classes, there are dancing classes. There is plenty of cooking that goes on in the kitchens. They cook for up to 5,000 people a week, and the cooks here are well versed with the rules of healthy cooking and healthy recipes. We had a group of women who got together and got the community looking at a strategy for change, and this strategy was subsequently presented at the temple 2 years ago. Since then, the PCT, as well as hospital consultants and doctors, as well as dietitians, the University of Warwick, medical school, medical students, and the charities such as Diabetes UK have all been involved in helping this community respond.
I first started working with Apni Sehat about 6 months ago. Shireen, who started it all, clearly saw that Apni Sehat was outgrowing just the Warwickshire start, that it had the capability of becoming a national programme, and this of course would create many challenges. Lots of people, lots of money, lots of complications. It was turning into a business.
Well, the social enterprise model allows me to innovate. It gives me autonomy over how we create this new service. And it allows me to work with multiple partners across traditional boundaries in creating the product. And it allows me to work with the user, with communities, at studying what they need and tailoring the services to meet their needs.
Well, I think people are seeking some new models. I mean, in this particular case, it's quite clear that service isn't ideally delivered through hospitals to some of these groups. They would like to get it in local community centres. Now, a new model requires a new type of business. And I think the Pathfinder Awards are great because they're allowing people to experiment with a new type of business.
Well, the social enterprise model allows health professionals to move into the areas where there is a gap in the health service and provide innovative services to meet that need.